should come as no surprise to most dermatologists that most patients have either looked up their condition before they come in to see us in the office, or they've looked up which condition they think they have. And a lot of them have sort of preconceived notions that they've searched on Google or other search engines about what their condition is, what their treatment should be, and what it is that we should or should not know about their condition. And I think there's some patients that are honest and they come in and they say, "Doc, I've already looked this up and this is what I think that I have." Or some patients will sort of keep that in the back of their mind, and then once we tell them what we think they have, they'll say, "I looked this up and I think that it may be this. What do you think about that scenario?" So I think it's very important that we always realize that patients are much better informed than they were 10, 15, 20 years ago. And when I say informed, I really mean they could be really informed or they could be completely misinformed, because there's a lot of misinformation that's out there that patients may be reading and they may believe or may not believe. And then when they come and see us, these ideas are really in their head already, so we have to be aware of them. I think most of our patients come in and have an idea of what their diagnosis is, and sometimes they're right. Sometimes they'll go to a website and consult one of the big referring websites and really look up what they have, and they're correct. So sometimes they'll have a seborrheic keratosis and they'll say, "Doc, I think this is a benign keratosis, but I want you to take it off, or I want you to check," or "I'm worried about a mole because I saw a picture of a similar mole online and I really think that it could be atypical. What do you think?" Or pictures of psoriasis or eczema are really, really easy to find. But sometimes they come up with the most bizarre things, and that usually has to do with dermatologic manifestations of other conditions, and usually they're sort of supratentorial things that patients describe as bugs crawling on their skin, or neurotic excoriations, prurigo nodularis. So there is a lot of misinformation out there, and while I always try to take the time to listen to what they think they really have and what they think makes their condition better or worse, I do think it's important to not feed into that if you think that their patients are completely on the wrong track, and really say to them, "Listen, I really think it's this." So the way that I deal with it is I always say, "Look, we can always try to do a biopsy or a scraping. We can take a culture, and guess what? I've been wrong before. I will be wrong again. So therefore, let's check." And once you have that report that clearly shows what they may have, which is different from what they think, it makes the interaction a little bit easier to say to the patient, "Look, I know you were convinced you have this diagnosis, but I have this pathology report that clearly shows that it's not. So can we at least try my treatment for a few weeks to see if we can make it better? And if we can't make it better, maybe we should try to reconsider something else." So I do think you have to take things with a grain of salt, but guess what? Our patients are right a lot of the times. Most patients are worried about side effects of medications, and these could be topical medications or oral systemic medications or biologic injectable medications. So it's very important to set the bar straight from the beginning to sort of go over all the bad things that could potentially happen, even though they may not be all-encompassing things that are in the package insert. So I always tell patients that you're going to go home, you're going to take out the package insert, you may read about all sorts of things that could have happened in the study, but these are the things that we think are really important about this medicine. So I want to make sure that we are okay with you taking this prescription and you understand the potential risks. I also think this improves compliance because patients realize that we're not scared of the potential side effects, because guess what? If something does happen, we can potentially deal with it, we could help, and these are the steps that we would take. So I think it's very important to have that conversation in the beginning. I go back to what Joe Uritza taught me when I was in residency, which is what you tell patients at the first visit is patient education. What you tell them at follow-up is an excuse. So it's very important to invest a little bit of time to talk about the potential interactions or side effects of medication. Now, there is something that I call the package insert effect, where they go home, look at the package insert, get scared, and then they don't want to take the medication. And some patients, you can tell from the beginning, they're going to be cautious. So with those patients, before I start them on a medication, I'll jot down a few names of drugs that I think that they would do well on, and I say, okay, go home, look these up, come back in 2 weeks, and we could sort of have a more meaningful discussion about what you think that you'd be comfortable taking and what I think would help your condition. Because if you give them choices that if they pick any one of them you think that get better, that it doesn't really matter which one they pick as long as they're going to be compliant and they're comfortable with that medication. So I do think it's very important to put in just a little bit extra time in the beginning to sort of set the bar straight, to make sure that they understand what the potential risks and benefits are, and to let them know that we understand those risks and benefits also, and if something bad does happen, we can deal with it. We as dermatology providers should empower our patients to use the internet to really improve their condition and help them improve their life. So patients that have various conditions that have a lot of support groups, I always refer them to those support groups. So if a patient has psoriasis, I always encourage them to go on the National Psoriasis Foundation website, or if they have acne and rosacea or alopecia, to go on those websites and really look up credible information that I think would be helpful to them. Because there are lots of things that are out there that we may not even be aware of. For example, there's something called the eczema diet that patients may want to go on to help with their condition. Well, somebody who has eczema that's done it, I think would be a more credible source than myself, and I may know the basics of it, but really, what do you eat? How much do you eat? What kind of food do you buy? Where do you buy it? I think those are all things that, if it's an incredible source, those can be important. And I'd rather refer them to a website, because I know they're going to look it up anyway, than have them just search whatever website there is and have some person who's living with their mother in the basement who's blogging about something they may or may not know about. So it's really important to really provide them with credible information and sources of that information. So I always say you can always go to the American Academy of Dermatology website. You can go to my website. You can go to this national organization for this condition that you have, and really look up things that you have questions on. And this way you can become more informed, and when you come back for your follow-up, if you have more questions, we can always have a meaningful conversation, as opposed to, doc, do you think the South Beach diet or the gluten-free diet or this or that is going to help with my condition? And I think diet is such an important part of our daily lives that I have not met any patient who hasn't asked about a chronic condition, is there something that I'm eating? Is there something that I can change about my diet that will improve my condition? So I think it's very important to address that from the beginning and say to the patients, look, go to the NPF website, see what other psoriasis patients have tried. Maybe there are things that you'll find that will help you. And having a healthy diet is good anyway, so why not encourage patients to do it for their general health if you have the opportunity to do so. In conclusion, I think it's really important that we realize that there's lots of information for patients to read online. And while some of it is good information, most of it really is misinformation. So it's our job to not only be a physician, but also to be an educator and point the patient to the right resources. And I really believe that that will improve the patient's outcome, their compliance, and really the physician-patient interaction, because it's much easier to treat a well-informed patient than a misinformed patient or a patient who has no information.